All right, I think we've got him now. Tulsa City Mayor G.T. Bynum.
Thanks, Richard. Banner day for Zoom in Oklahoma governmental meetings last 24 hours. 6 weeks ago tomorrow, we initiated a ban on large events in Tulsa. Shortly after that, we closed restaurants and entertainment venues. 4 weeks ago tomorrow, we began our shelter in place initiative in Tulsa. As a community, we took all these steps to save the lives of our neighbors. And we saved those lives by practicing social distancing, slowing the spread of COVID-19, and protecting the capacity of our healthcare system to properly treat those most in need of care. We also did so to give our local healthcare system the time it needed to secure proper equipment and establish proper procedures to protect healthcare workers while treating those in need. Faced with a virus to which no Tulsan was immune, we had to act quickly and in an unprecedented way to avoid a sudden overload of our healthcare infrastructure locally. The commitment of Tulsans to social distancing at a local basis and those measures that we put in place over the last 6 weeks have accomplished all of the goals that we set out to accomplish when we put them in place. According to the hospital leaders that I've spoken with here in Tulsa, our hospitals now have a proper supply of protective equipment. They've seen a decrease in hospitalized COVID-19 patients over the last 3 weeks, and they're comfortable with their capacity to handle increased demand moving forward. We've driven overall illness rates below projected levels, and our death rates per capita in Tulsa remain low compared to many of the major cities you hear about on the news because of our early action. I want to thank every Tulsan who sacrificed over the last 6 weeks to get us through this crucial period, and especially those who've lost their jobs. The road to economic recovery will be long, but we must support one another throughout it. I also think it's very important to recognize the many workers who did not have the option of social distancing because they work in a business designated by the state as being essential. These Tulsans have gone about their daily lives with elevated risk to keep our community and their industries going. And I want to thank one group that I don't feel has received enough credit through all of this: tribal governments that overlap with Tulsa. You always remember those who stand with you in a difficult time, especially when they don't have to. And I hope Tulsans never forget that Chief Chuck Hoskin Jr. of the Cherokee Nation, Chief David Hill of the Muskogee Creek Nation, and Chief Jeffrey Standing Bear of the Osage Nation did what they had to do to protect Tulsans in this challenging time. Last week, President Trump announced a framework for communities to re-engage their economies through a carefully phased rollback of social distancing measures. And on Wednesday, Governor Stitt announced a plan for Oklahoma based on a similar premise. As I told Governor Stitt in advance of his announcement, I'm thankful for his development of uniform statewide guidelines for industries to follow. One of the challenges in establishing social distancing practices at the outset of this pandemic was that in the absence of action by the state government, cities were forced to form an uneven patchwork across the state of Oklahoma. Having a uniform standard would have been better from the start, and I'm thankful that we'll have one moving forward. I believe the guidelines that the state is rolling out will help reduce risk as we re-engage our economy. Aside from the substance of the rollbacks and what they look like, the other issue, as we've talked about in these meetings before, is timing. And this one, for us in Tulsa, is more challenging. The Trump administration recommends several criteria to meet before initiating a phase 1 rollback. Among these are hospital capacity, which our hospitals tell me they have, and robust testing for healthcare workers, which the state tells me we have. The White House recommends 14 days of declining test cases before initiating the first phase of rollbacks. According to the Oklahoma State Department of Health, Oklahoma meets that benchmark. This is great news for all of us as Oklahomans, and I don't think we'd be there if it weren't for the action taken by our metro areas during this pandemic event, and it's why the state's first phase of rollbacks is announced to start today. The challenge is that according to the Tulsa Health Department, Tulsa County has not yet met that final criteria. According to the Tulsa Health Department, our cases in Tulsa County over the last 14 days are in fact trending upward, not down. If we were to follow the federal standard locally, we would wait for the 14-day decline to occur and then begin rollbacks. But Tulsa does not exist in a bubble. We do not get that choice. Because of the state government's initiated rollback and the willingness of other communities in the region to follow it, we should expect more people to come in contact with one another. And we should expect the virus to spread at a more rapid pace in our metro area. As a result of that increased regional activity, our local health experts tell me that Tulsa's cases will not go down, they will increase. Waiting on those cases to decline as people for 100 miles in every direction are being encouraged to ease social distancing would be futile. Tulsans have already undertaken an unprecedented system of sacrifice to slow the spread of this virus in our community. While hard to do, most of us followed that plan because of the logic behind it pointed toward it being effective. And every indicator is that it was. I cannot, in good conscience, ask Tulsans to continue making these extreme personal and financial sacrifices at such a level in pursuit of a goal that will be impossible to reach in any reasonable period of time. It's also important to remember that the virus, as Dr. Dart just said, will not disappear on May 1st or any time in the foreseeable future. The point of our work over the last 6 weeks was to buy our healthcare system the time it needed to prepare for that long haul and to avoid a sudden surge that would overwhelm our healthcare system. After discussions with the leaders of each of our major health systems in Tulsa, I've heard from every single one of them that they're confident in the ability and in their ability to move forward and care properly for Tulsans as phased rollbacks occur. So our goal for the future is to continue managing risk as best we can while helping Tulsans go back to work safely. Our Safer at Home order will remain in effect through April 30th, at which time it will conclude. Effective May 1st, new order will be in place that reflects both the federal and state guidelines for phase 1 rollbacks. Our shelter-in-place policy will discontinue at that time. The state's guidelines for industry will be enforceable, and social gatherings should be restricted to less than 10 people in accordance with federal recommendations. This order will be adjusted when the state determines that phase 2 is to take effect. As we move forward, each of us should continue the same strategy we've deployed to date. Focus on the things that we can control. Heard from a lot of business owners who are concerned about reopening safely. If you don't feel you're ready to open with precautionary measures in place, we'll support you when you're ready. Thank you for putting the safety of your employees and your customers first. Employers should continue to facilitate remote work throughout phase 1 as much as is possible with business operations, again, according to federal guidelines. We'll continue to do that at the City of Tulsa. We should all wear masks in public, not as a sign of terror that we might contract the virus, but as a sign of respect to our neighbors that we may be carrying the virus without knowing it, and we're wearing a mask so that we can help reduce our ability to contaminate others. Non-essential travel should continue to be minimized, and if you're over 65 or have a compromised immune system, you should follow the state's Safer at Home order. For city park facilities, playgrounds, and recreation centers, they will remain closed. City pools will not be opened this summer, and day camps at city parks are canceled this year. Golf courses and tennis facilities will be reopened, on May 1 with the safety precautions in place that Commissioner Keith mentioned a moment ago. The White House guidelines are really helpful. You can find guidance for individuals and employers through each phase of the rollback at whitehouse.gov/opening America. While our testing capacity has improved, we still have a long way to go before it is as accessible as it should be, and we will continue to work on this at a local level. And while the Tulsa Health Department established contact tracing with the very first positive case in our community, they're going to need more technological support and staffing as this virus spreads, and we will continue to pursue both. While I'm disappointed that Tulsans were not given the opportunity to position our city at a level of safety recommended by federal authorities, I'm grateful we've made as much progress as we have, and we've given our healthcare system the chance it needed to manage a prolonged pandemic event. It isn't ideal, but I know Tulsans will make the best of the circumstances that have been handed to us. That's what we always do. And to that end, Tulsans in our everyday lives have taken the necessary precautions to protect ourselves and our families. The need for that does not change as we move forward. The statewide guidelines for industry are important to follow, and we should all continue to practice caution, social distancing, and proper hygiene in our personal lives. In closing, I want to thank all of those in our healthcare community who will tend to the sick and dying throughout this pandemic event. The actions of most in our city have shown you how much we support you. And I want to thank every Tulsan who's put the lives of your neighbors first. Your actions over the last 6 weeks have been part of one of the great collective humanitarian efforts in history. And all the local metrics I have seen indicated that you saved thousands of lives, the lives of people in this community who will never know to thank you, because your service to them was the absence of illness in this crucial period at the outset of a global pandemic event. Thank you. I'll now turn it over to Sheriff Regalado.
Thank you, Mayor. Please stand by.